He's 89 years old. I started training with him 3 days a week at 7 in the morning. We would meet at the beach. He actually started to get some congestive heart failure symptoms. He's doing healthy diet, healthy hydration. He's doing foundation training, and we're trying to keep him going for as long as possible. Is it too late? No. The laymen around the world via social media are starting to share what the nervous system looks like when all of the other barriers are taken away, and we look like aliens, we look like octopuses, we look like squids. It's hysterical to see a brain, a spinal column, and the peripheral nervous system and the enteric nervous system put together. We look like the weirdest organism. Our nervous system is our teacher and our performer and our learner. The structure around it can really hinder the capacity of the nervous system to perform what it's learned or to learn what it's meant to perform. We have to get our nervous system so good at controlling our muscles that we can literally pull ourselves out of our own way, that we can create an active scaffolding that is being pulled accurately by the muscles that surround it, which are our primary stability features. If those muscles ain't working, we go and we rely on secondary rigid stability, which is joints, connective tissue, ligaments. And that is kind of like the big discerning difference between kind of a compartmentalized reactive medical idea of how the body can impact the way we feel, the way our energy is, the way everything, the way we communicate, to kind of a much more holistic side of it, which is everything affects everything. If the house that your nervous system lives in isn't accurately functioning, it's going to be very hard to feel well, plain and simple.
So, man, that is poetry in motion. And as you're talking, I'm flashbacking to all of these things that have happened to my musculoskeletal body. Is it ever too late to start foundation training?
I mean, not to start, but to get the legitimate benefit of it. I say yes and no because the reality is it's personality dependent. I'll tell you about Alan Beal, who is one of my favorite patients I've ever worked with, and he's 89 years old. I met him a year ago, post 4 or 5 level laminectomy of his low spine. A laminectomy is where they remove the back half of the vertebra to create a non-pressurized space to heal something called spinal stenosis, which is major. Stenosis is centralized encroachment on the spinal cord because for whatever reason, the body's absorbing force internally at the spinal column, and it's adding layers of calcium centrally instead of peripherally.
Your spine is getting... Your spinal cord is getting choked by the spine.
It's getting choked, exactly. Yeah. So they do this pressure relief. It is one of the most barbaric and effective surgeries in the world. And what's crazy is they don't put anything back on. They put like a mesh over it, and it's like this. Just your body just heals.
Little Gore-Tex.
Yeah, they put it's easily negative 20 degrees. You're fine.
So my little back is warm, but my toes are freezing.
So there's like this. I was admittedly. He probably didn't know this, but I was nervous to work with him. Like, oh, crap.
That tells me you're an honest practitioner. Like all this stuff, like nothing ever goes wrong. And I'm like, you're not practicing.
What am I going to do with you? It's crazy because he came up to me. I was teaching classes. For the past year, I taught 50 classes on Kauai every Saturday for 50 Saturdays in a row. And it was a free class for the community, and it was really wonderful who came. I met a lot of people, and Alan was a very regular at those classes. I actually stopped the classes to come back out here to be on the mainland for a couple months. Alan would kind of come talk to me after the class, and I would watch him, and he's not getting that strong, but he's doing it, he's going through it. And then we started doing some privates, and he started coming over, and we just ramped it up. And then I started training with him every single, 3 days a week at 7 in the morning, we would meet at the beach. So this is an 89-year-old guy who's ready to do this. So I'm like, well, I'm not going to be the guy who says no.
That's epic.
Of course I'll do this, Alan. I'd love to do this with you. And not only is this feeding me and my soul, but I'm watching this dude get better. Now, some things happened where he actually started to get some congestive heart failure symptoms from a couple of he has a pacemaker, he's 89, he's got a couple of things, and he got off of gabapentin. He had major neuropathy, and that was the biggest thing I was treating him for. And we made some pretty impressive symptom changes and strength changes. And so much so that he actually completely got off of gabapentin.
Wow.
But while that helped his neuropathy, it did not help other parts of nerve communication, including in the heart. It didn't kill him or anything like that, but it gave us a new set of things. I'm like, well, number one, this is not my specialty. You need to be with your cardiologist.
Sure. Well, that's interesting to think gabapentin would have some cardiac effect.
And then, you don't think, it's not something we would think, it's just, especially not in my wheelhouse.
Well, for sure. With a chiro background, you're thinking they're doing this for neuropathy.
Exactly.
Yeah.
So He's still off the gabapentin, and he was diagnosed with another, or not really diagnosed, but kind of said, hey, your congestive heart failure is acting up. Now, here's the interesting thing is the real beneficial thing to do with congestive heart failure is healthy exercise and healthy diet and healthy hydration. So that's it. That's what he's doing. He's doing healthy diet, healthy hydration. He's doing foundation training, and we're trying to keep him going for as long as possible. But I bring that up for two reasons. Is it too late? No. But when you are working with a much older body, an octogenarian, further even, septuagenarian, 70 plus, you're going to get hit with things that you don't anticipate and you can't anticipate. So for a practitioner that's hearing this, expect it. And don't let your ego get in the way. Just say, okay, let's try to collaboratively with the rest of your medical team, look at this symptom. But would I ever ask Alan to stay in the pain that he was in for the past year? He would have said, I would do that training 10 times over, knowing that I was going towards congestive heart failure. I don't think they're one and the same. I don't think they're connected, but the body's the body, and it's very connected no matter what.
And it brings the point where I probably refer as an ND to specialties or to other doctors or other providers or non-conventional providers more than anyone I know, because I know what I know and I know what I'm not in charge of.
Yes.
Right. And there's just, so that's where you move into a team care approach, and you're in charge of no pain.
And what's a success story? Is a success story getting out of the symptom they came to you for, or is a success story somehow being the one person in the world that can guide every patient you've ever had towards a long life with no mortality and none of the normal stuff that human beings go through? It's unrealistic.
Yeah.